Hi, my name is Dr. Vas, and today we're going to discuss acoustic neuroma. Uh, it's also called the vestibular schwannoma. That contain this discussion contain description, symptom, diagnosis, and treatment. That is the overview. Acoustic neuroma, called vestibular schwannoma, also is a benign, usually slow-growing tumor arising from the Schwann cell or vestibular portion of cranial nerve. The key message regarding this persistent unilateral hearing loss or tinnitus should be evaluated for acoustic neuroma. That is the image for the acoustic neuroma. The anatomy, that is the anatomy of the ear. What happens? Tumor rises from Schwann cells uh, of the vestibular branch of cranial nerve 8. Uh, Common locations: internal auditory canal and cerebellopontine angle. Compression of cochlear nerve fiber can be produce hearing loss and tinnitus. Nature of tumor: benign or non-metastatic, but symptoms can be worsened with growth. Common symptoms that rises with the disease: unilateral or asymmetric sensory neuronal hearing loss, tinnitus, ringing or buzzing in the affected ear, imbalance, dizziness, unsteadiness, oral fullness may occur, facial membrane or facial numbness or tingling can occur with large tumors. The clinical cue related to the acoustic neuroma: unilateral asymmetric symptoms are more concerning than bilateral non-specific symptoms. Mechanism, that is the mechanism, core disease concept. The neuroma is usually benign, slow-growing vestibular schwannoma. Tumor expands towards the cerebral pontine angle and compresses nearby neuronal structure. Symptoms result from neural compression, impaired conduction, and local mass effect. Molecular initiation: uh, NF2 genes may alter or the Marlin dysfunction, loss of contact inhibition, Schwann cell proliferation, vestibular schwannoma. Marlin function is very important. Marlin act as a tumor suppressor protein in Schwann cell. When Marlin signaling is lost, growth control becomes impaired. Growth factors: PI3K, AKT, mTOR, MAPK, FAXORC, and Hippo-YAP may support proliferation. Biological results: clonal schwannoma or clonal Shaw cells expansion forms a benign tumor around cranial nerve 8. Linear cochlear plus vestibule, cranial nerve 8, vestibular nerve, internal auditory canal causes the benign tumor. Early stages: tumor compresses vestibular cochlear fibers within the narrow internal auditory canal. Hearing and tinnitus symptoms often appear early. Expansion: tumor may expand into the cerebellopontine angle. Local mass effect increases with the size. Large tumors may compresses cranial nerve 5, cranial nerve VIII, uh, brainstem, cerebellum, and CSF pathway. These are the nerve compression and symptoms: cochlear fibers, hearing pathway, vestibular fibers, balance, pathway, facial nerve, cranial nerve 7, motor or autonomic, and trigeminal nerve, cranial nerve 5, facial sensation. The conduction towards these pathways may suppress in uh, this disease. Brainstem cerebellum mass effect causes the compression and distortion of and conduction. Headache, hydrocephalus, severe gait problem might occur in the patient. These are the summary points, molecular and cellular level. Schwann cell normally myelinate vestibular nerve fiber. Growth signaling and impaired contact inhibition allow benign encapsulated tumor to form. The tumor is histologically benign but clinically important due to its location, because it might uh, spread towards the brain also, and as well as the facial uh, and other parts of the brain, and as well as the facial segments. Anatomical and clinical level, early compression affects vestibulocochlear nerve function, cochlear fiber involvement causes unilateral sensory neural hearing loss and tinnitus. Large tumors may affect facial, trigeminal nerves, brainstem, cerebellum, and CSF flow. These are the diagnosis point. Clinical presentation, audiologic evaluation might be there. The physician should go for the audiological evaluation, vestibular assessment, and imaging. This is the diagnostic workflow. History, genetics, vestibular testing, MRI, and imaging may help plan the observation, radiosurgery, or microsurgery. Treatment options, these are the treatment options. Observation, radiosurgery, and microsurgery might help the patient. Main approach is stereotactics, radiosurgery, microsurgical removal from large tumor, hearing preservations, facial nerve function, tumor control, and quality of life guide decision making. Treatment should be planned by experienced ENT neurology and neurosurgery team. That is the summary description. Benign Schwann cell tumor of vestibular cranial nerves 8 near the internal auditory canal. Symptoms, unilateral hearing loss, tinnitus, imbalance, dizziness, and some facial membranes and membrane nerve numbness. Diagnosis, audiometry sport suspicions. Treatment, observation, stereotactic, radiosurgery, microsurgery, depending on the tumor and patient factors. That is the source basis. Thanks and regards. Please like and subscribe this channel, and for further uh, discussion on different diseases, pharmacological diseases. Thanks.